A school in Rosrath, Germany has temporarily closed due to a health concern that has alarmed the community. 2 kids tested positive for Mpox, a virus that has been causing outbreaks in various parts of the world. Mpox, which used to be called monkeypox, is a sickness caused by a virus. It can spread from person to person through close contact. The school closed as a safety measure to stop the virus from spreading further among students and staff. Students are learning from home now, using online resources and virtual classrooms to continue their education. The school will stay closed until at least December 20th, 2024. This situation is worrying for parents and teachers alike. Health officials are working hard to stop the outbreak. They are implementing measures to ensure the safety of everyone involved. They are finding people who might have been exposed and giving advice to the school and families on how to stay safe and healthy. This reminds us that infectious diseases are real and can affect our daily lives in significant ways. We need to be ready and informed to keep our communities safe. Staying updated with health guidelines and supporting each other is crucial during these times. The Mpox cases at the school are connected to a family. This family had no idea that their lives were about to change dramatically. Someone in the family traveled to Africa and got the virus. This trip, meant to be a memorable adventure, turned into an unexpected health crisis. This person then accidentally spread the virus to 3 other family members. They were unaware of the infection at first, thinking it was just a common illness. 2 of those infected are the children who go to the school in Rosrath. The school community was shocked and concerned about the sudden outbreak. This travel-related spread shows how connected our world is. In today's globalized society, a virus can travel thousands of miles in just a few hours. Diseases can spread quickly, crossing borders and impacting communities far from where they started. This highlights the importance of global health surveillance and cooperation. It shows how important travel health is. Travelers need to be aware of the health risks associated with their destinations and take necessary precautions. Taking precautions before, during, and after travel is important to stop infectious diseases from spreading. Simple actions like wearing masks, using hand sanitizer, and getting vaccinated can make a big difference in protecting public health. Mpox is usually milder than smallpox, however it can be more serious for kids. The virus spreads through close contact. This includes touching bodily fluids or things that are contaminated. After being exposed to the virus, it can take 5 to 21 days for symptoms to show up. Early symptoms are similar to the flu. Fever, headache, muscle aches, and swollen lymph nodes are common. A rash usually appears after the first symptoms. It starts with flat sores that turn into blisters and then scabs. The rash can last for several weeks. Section 4. A global health concern. This outbreak in Germany isn't the only one. Mpox cases are increasing around the world. The World Health Organization, or WHO, is worried about this trend. The 2022 to 2023 global outbreak reminded everyone how quickly Mpox can spread. The virus, first discovered in 1958, comes from animals. The first human case was reported in 1970. Since then, outbreaks have happened from time to time. This recent increase shows we need to stay alert and take proactive public health measures. Section 5. Combating the outbreak, response and prevention. In this section, we will explore the various measures being taken to respond to the outbreak and prevent further spread of the virus. German health officials are acting quickly to the outbreak. They are coordinating efforts across multiple agencies to ensure a swift and effective response. They are working to find everyone who may have been exposed to the virus. This involves extensive contact tracing and interviewing individuals to track the virus's spread. Taking care of those who are infected is important. Medical teams are setting up temporary facilities to provide care and support to those in need. This includes managing symptoms like pain and fever. Health workers are providing essential medical advice and administering treatments to alleviate symptoms. Making sure people have enough to drink and eat is also important. Volunteers and health workers are distributing food and water to ensure that everyone has access to basic necessities. Prevention is key to controlling the spread. Public health campaigns are emphasizing the importance of preventive measures to stop the virus from spreading further. Vaccination is recommended for people who are at high risk. Vaccination drives are being organized to protect the most vulnerable populations. Public health messages emphasize good hygiene, like washing your hands. Hand-washing stations have been set up in public areas to encourage proper hygiene practices. Avoiding close contact with infected people is also important. Social distancing measures are being enforced to minimize the risk of transmission. By working together and following health guidelines, we can handle this outbreak effectively. Community cooperation and adherence to health advice are crucial in overcoming this challenge.